everyone. My name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Quality Counts, Practice Recording the 5 Performance Measures for SBHCs. During today's presentation, we will give a brief overview of the NQI, describe the nuts and bolts of reporting, show you the data portal, and have time for questions. But before we begin, we have a few housekeeping reminders. First, please help us with our attendance count. If you are viewing as a group, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones plus 3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archived webinars for topics such as the ones you are currently viewing on your screen. I will now turn it over to my colleague, Haley Love. Thank you.
Good afternoon, everyone, and thank you so much for joining us this afternoon for this webinar. My name is Haley Love. I'm the Director of Research and Evaluation with the School-Based Health Alliance, and my colleagues Samira Solomonpour and Matt Even are here with me, along with Tiara, and they'll be helping and supporting and answering some of your questions that we'll address at the end of the webinar. So we have a really incredible team working alongside Matt, Samir, and myself on this initiative, and we just really, again, want to thank everyone for the efforts that they've invested and will continue to invest and make it strong as we reach towards our goals. So this is the 4th webinar in a series of webinars that we've been giving over the past several months. If you want to view the previous webinars in the series, you can view them on our webpage here. If you go to our www.sbh4all.org and click on Resources and go to Quality Counts, you'll be able to access the archived webinars. In the first one, we introduced the School Health Services National Quality Initiative, the 5 performance measures, how they were selected, and how to use the resources we've developed on our Quality Counts page. On the second during the second webinar, we talked about how to set you and your electronic health records up for success in documenting and reporting the 5 performance measures. We talked about how you can talk the talk with your IT or EHR vendor and some of the challenges and successes relating to adapting electronic health records for this work. The third webinar included a panel of speakers who have been a part of our learning collaborative during the past year who have adopted and reported the performance measures. And they really did an excellent job of describing some of the challenges and the promising strategies that have emerged from deeply investing in this work. So we encourage you to review those webinars and those topics as well. But let's get into this webinar. Today we're going to give a very brief overview of the NQI and what this initiative makes possible for the field. I'm going to talk a little bit about the nuts and bolts of reporting, addressing some key questions that I think you may have. We're going to do a demonstration of the NQI data portal, which is the portal that Matt developed for you to be able to enter your performance measures. And we're going to end with discussion and questions and try to address any questions you may have at this point. So let's start at the beginning. As we discussed in previous webinars, but want to repeat for those of you who may be joining us for the first time, the School-Based Health Alliance was awarded a grant from the Maternal and Child Health Bureau for a project called the School Health Services National Quality Initiative. It's challenging the school-based healthcare field to voluntarily adopt and report the first ever set of standardized performance measures for school-based health centers. So we needed a set of performance measures. Through a 6-month process which engaged stakeholders in the field, and more than 100 individuals participated in this process, we challenged this group of people to think about and engage with the best ways to demonstrate the value add of school-based health centers to the healthcare system, to really show how they're working to ensure high-quality care is delivered to children and adolescents. And these stakeholders decided that children and adolescents having an annual well-child visit, risk assessment, and BMI screening, as well as depression screening and chlamydia screening, were a really great starting point for the school-based healthcare field to start to demonstrate this value add. These measures align with existing national child quality measurement frameworks such as HEDIS, CHIPRA, or Meaningful Use, allowing school-based health centers to compare themselves not only with one another, but with other healthcare settings. The Maternal and Child Health Bureau set out an ambitious target for us. They want to see 50% of school-based health centers voluntarily adopting and reporting the performance measures by 2018. So we couldn't be happier that all of you are here and engaged and joining us in this initiative that we really feel like has the potential to tell a new and better story about school-based health centers. You guys are our early adopters, and we're just can't wait to get involved in working more closely with you as you engage in this work with us. So what does this initiative make possible for us? We believe that if school-based health centers can align priorities and voluntarily collect data in a standardized way, we'll be able to describe the quality of care being delivered in SBHCs at the national level, which is paramount to the sustainability of the model. There are states that are doing really excellent work as it relates to the adoption reporting of performance measures, but at this point, we don't have a national data set or participation in initiative where we can tell this national story about care being delivered. So really, as the healthcare landscape becomes increasingly competitive, we need to be able to demonstrate the care being delivered. By reporting standardized data to the Alliance, SBHCs will be able to compare themselves at local, state, and national levels to assess their strengths and areas for improvement, so that data can really be driving quality improvement. And by investing time in assessing our data and identifying ways to improve practices, the quality of care that children receive will improve. So let's get to it now and discuss these nuts and bolts of reporting data to the Alliance. We're going to go through a series of questions, then we'll do a demo of the NQI data portal, and then we'll get to your questions. So, how many times will you be asked to report data during the 2016-17 school year? During this school year, which we're viewing as our pilot year, there will be 2 opportunities for reporting data. The first opportunity, which we're calling our practice run, starts now. We have nearly 150 school-based health centers so far who will voluntarily practice reporting the performance measures. And what we've learned is that this practice is really important. One of the key learnings from our learning collaborative over the past year is that data extraction and reporting is challenging and can unveil some really important things. For example, providers might not be documenting the work that's being done completely. Providers may need to ensure that they're reporting data in the same way with the same codes. You may need to build a relationship with your EHR vendor or IT support if it's available to you in order to extract the data, and even perhaps to adapt your electronic health record system so that it's collecting the data that's being asked of you. The second opportunity, which will occur at the end of this school year, will provide an opportunity to report all 5 of the performance measures for the full school year. We have more than 300 school-based health centers so far who have committed to reporting the performance measures at the end of the school year, and we hope to see this number grow. So what data will you be asked to report? We're asking school-based health centers to report as many of the 5 performance measures as they're able to report. If you go to our website, as I mentioned earlier, to our resources page and click on quality counts, if you select the 5 performance measures, you can download the measure definitions or scroll through the page and view tables with the measure definitions. And those resources will show you the exact data points that we'll be asking for you to report. So when you log into the data portal, which I'll show you very soon, you're going to be asked to report information about your school-based health center, very basic information, name and contact information, and the schools served by your school-based health centers. You'll be asked to report client and visit data, and as I mentioned, as many of the 5 performance measures as you're able to report. Since the beginning of this initiative, we've talked about meeting the field where it is as it relates to reporting the measures. If you're only able to report one of the measures at this point, that's great. If you're able to report all 5, that's excellent too. So what are the reporting periods for the 2 opportunities? The practice run, which I mentioned starts now. The measurement period is the start of the 2016 school year until December 31st of 2016. So your school year may or may not have started on July 1st. That's just a suggestion, but you want to start. You want to report data from the first day of school until the end of until the end of 2016. And the data entry period for this practice run will be next week. We'll be sending you an email when the portal's open. And the portal will be open for reporting until March 1st of 2017. If there are exceptions when you may need an additional week or 2 in order to report your health center's data, we can absolutely accommodate that and work with you. You just need to let us know. The second reporting opportunity at the end of the 2016-17 school year, we'll ask you to report for the full school year. So July 1st, 2016 until June 30th, 2017, or whatever the first and last day is of your school year. We'll open up the data portal again in the summer and keep it open through the fall of 2017 in order for school-based health centers to report their data for the 2016-17 year. So when can you share your data? Like I mentioned, for the practice run, the portal will open next week, and we'll send you an email to let you know when the portal is open. Our target is to open it midweek, and you'll see an email from us when it's launched. And you'll have until Wednesday, March 1st to enter your data. So who will report the data to the Alliance from your organization? I sent out a survey in November, which asked individuals to let us know who would be responsible for reporting data for their organization if they had demonstrated interest in participating in the initiative. If you or one of your colleagues completed that survey, you've been granted permission to access the NQI data portal. You will know that you were one of those people because you will have received an email from me yesterday reminding you about today's webinar. So if you didn't receive an email yesterday, we are going to ask that you either email Matt Even at meven@sbhforall.org, or write your name and email address into the chat box on the right, and we will grant you access to the NQI data portal to enter data for your school-based health centers. So let's talk a little bit about reports. We are planning to launch the reporting capabilities of the NQI data portal in mid-March of 2017. And so how do I view the report? You'll go to our website and you'll see a page that looks like this. It's on the top button, which you'll click on to enter your performance measurement data. That will be obviously where you enter your performance measurement data. And the second button will allow you to download reports. And you'll be able to do that. We'll also let you know when that reporting portal is open for you to download those reports. So what will the report show me? We really want to know from you guys what you think would be the most helpful filters for comparing your data to averages of other school-based health centers who are participating in this initiative. So what's important to know here is that you, the school-based health center and/or its sponsor organization representative who is sharing the data, will be the only person who will be able to see the data about your individual health centers. However, we believe that being able to compare your data with averages of other school-based health centers participating in the initiative can be really powerful for showing where you are in comparison to other school-based health centers, for identifying other states that may be doing particularly well, and for the opportunity to connect with us, to connect you with others who may be doing particularly well. But really important to know that your privacy and security is extremely important to us, and any data that you see related to your health center will be compared to averages. But that being said, what we're interested in knowing is how you would like us to format the reporting system and what you want to be able to compare your data to. So we're going to launch a poll question right now that's going to ask you to select whether you would like to see your data compared to all school-based health centers participating in the initiative, SBHCs by state, SBHCs by grade level served, SBHCs by sponsoring organization type, or anything. If you have another idea of some unit you want to compare your data to, we ask that you type that into the chat box. You can select more than one option here, so if you can select all of the filters that you think would be most useful to you, then we'll be able to start to get a better sense of how you want to see those reports. All right, so we're sharing the responses on the screen. Thank you for sharing those ideas. That's very helpful to us. And if anyone wants to share any of those responses, those 6% who said they would like to see another way of comparing their data, please enter that information into your chat box now so that as we work towards developing these reports, we can take your feedback into consideration. All right, so now we're going to transition, and I'm going to show you the NQI data portal and what it looks like and how you'll be using it. All right. When you first come to the NQI data portal, and the email that I'll send out next week when we announce that it's open will show you exactly where this will be on the website. But it will be under Resources, Quality Counts, and you'll see a new filter here on the website that says Enter Data. And there you'll be taken to a page like this. So the first thing that we want you to do is to read, understand, and agree to the conditions of the NQI Data Privacy and Security Policy, which is hyperlinked here. You can download and review it before you enter into the data collection system. And there we just outline what I've just shared about how data will be protected, but you can review all of the nuances to it. So once you hit submit, you'll be taken to a page, as I showed you before, that looks like this, where you can enter your performance measurement data. So I'm going to pretend as if I'm a provider from the Metro Community Provider Network, an FQHC with several school-based health centers in Colorado. So what I'm going to do, if any of this information isn't yet filled in for you yet, you'll fill it in, but I'm going to select my state, which is Colorado, and then it asks me to select my SBHC's lead sponsoring or administrative organization. So I'm going to select Metro Community Provider Network. That agency is a federally qualified health center. Now I'm going to hit submit. Here you'll see the contact information that we have in our database at this point in time for the lead sponsoring or administrative agency. If you want to delete or replace any of the contact information here, click on delete and replace primary contact, and you can search our database for other contacts that we have or add a new contact into our database. So as you can see here in our database, we have 3 school-based health centers affiliated with Metro Community Provider Network. One of the 3, Jefferson Kids and Teen Clinic, has elected to report the performance measures as a part of the practice run. So I'm going to select that school-based health center. Let's say you're reporting for 3 school-based health centers. You'll select all 3 and hit continue. If you don't see your school-based health center in this list, you'll click on Add School-Based Health Center and enter the name, address, and city of your school-based health center here. But I'm going to move ahead with Jefferson Kids and Teens Clinic. This is the main dashboard, which shows you the information that you're going to be asked to report. So as we mentioned earlier, though you probably will have done this at this point, you can edit the sponsoring info. But what you can see here, if you read this legend here, is that each row has 5 columns indicating your completion status for the following sections. the sponsor contact information, the SBHC contact information, the schools served by the health center, visit data, and performance measures. So we've completed so far the sponsor, the SBHC contact information, and next we're going to complete the schools served. So I'm going to click on Edit Data, and I'm going to link my school with the health center. So what it's going to ask me to do is select from a drop-down menu. First, it's going to ask me to select this district. So my school is in Jefferson County School District. So I'm going to scroll down, or you can press J if you want to advance faster through the list. So I'm going to select Jefferson County School District. Now it's going to ask me what's the name of my school. So I'm going to scroll down again. And the school that I'm going to be reporting for is Jefferson Junior or Senior High School. I'm going to click on Select School, and I'm going to wait for a couple of seconds there until it pops up. And so now Jefferson Junior and Senior High School is affiliated with Jefferson Kids and Teens Clinic. Let's say that my school-based health center serves more than one school. I can click on Select Schools again, click on District again, and select a school from the list and add it to my list. And that's how you can add the additional schools affiliated with your school-based health center. This is a new functionality that Matt's recently built into the data portal, and this is to reduce burden for you guys having to enter characteristics about your schools, because we can pull data from the National Center for Education Statistics about your data. So we're hopeful that this will help expedite the process of sharing data with the Alliance. So I'm going to remove, oops, I removed the wrong school. I'm going to quickly load back in the correct school. And I'm going to continue. The next page is going to ask for the School-Based Health Center client and visit data. Here you're asked for data points about school enrollment, the number of unduplicated SBHC clients. So that's those School-Based Health Center clients who had at least one visit of any type to the School-Based Health Center during the school year. Then it asks you to stratify those unduplicated clients by age, gender, and ethnicity. And finally, it asks you for the total number of school-based health centers. If you responded not applicable to any of the data requested above, we'd be really grateful if you could explain to us why you were unable to report the data, because that's super helpful to us as we better understand some of the challenges in data documentation and reporting. I'm going to hit Save and Continue again. And the third page asks you to enter the 5 performance measures. As you can see, and I'm sure that you all have reviewed the definitions before, we ask for a couple of data points in order to compute the 5 performance measures. So here you'll see those data points that we're requesting. For the 5 measures. And again, if you selected not applicable for the data requested above, we'd love an explanation and would be super appreciative of that opportunity to better understand. So that's it. once you complete those numbers and put them in, these will turn green, and you know that you have completed reporting the information to the Alliance when all 5 boxes are green. So I am going to go back to my PowerPoint presentation. And we're going to talk briefly about next steps and then open it up for questions. So, the practice run. Starting next week, we're going to ask you to log into the NQI data portal and enter your data by March 1st, 2017. If you experience any challenges along the way, we encourage you to email us with questions. And now we want to open up to all of you guys and ask you if you have questions about anything related to the initiative and reporting data to the Alliance. If you could write them into the chat box, and we will start to scroll through them and address them. Okay, I'm just scrolling through to make sure I don't miss any of the questions, but thank you for the feedback here related to the reports. So someone asked, what if I have more than one district? Each school should be, you'll be entering the data for each school as it relates to the district. So the school is only going to be in one district unless it's a school that perhaps straddles a district line, in which case pick one. But unless I'm wrong, the school will be located in one school district. Your school-based health center may serve multiple schools in the district, but as it relates to addressing that question about what school your school-based health center serves, think about what district the school is in. The next question is, we see patients who do not attend our school but don't specifically serve the school they attend. So the enrollment would be less than the number of unduplicated users. Will that make sense to you all? Just need to review it for a second. So if you can add, like, I'm not sure that that completely makes sense to me. If you can add up the number of schools or the enrollment of the schools and provide a cumulative number of the eligible population to use the school-based health center, I think that would be the most helpful information. But I can follow up with you offline to talk about that question to make sure that I'm not missing something and that we can make sure that our system accommodates scenarios like this one. Good question. So the next question is, if you have 5 or more schools in one school district, do you report the total for all schools or individually? You're going to report for each school individually. So I'm going to go back to the NQI data portal for a moment and just show you what it's going to look like, what the screen will look like if you are completing this for more than one school, so that this makes sense. All right. So we're going to go back to Colorado. Go back to Colorado. Submit. Ooh, hold on. One more try. All right, so let's say that I wanted to complete this for 2 school-based health centers. I'll click on the 2 schools, and now I want to edit. Now I want to share the client and visit data for both the schools. Each of the schools will have their own column, so you'll be reporting the data for each school individually. So first you'll report the total school enrollment for Alameda Kids Teen Clinic. So here you can see if your school-based health center serves more than one school or is school linked, we're going to ask you to list the cumulative official total enrollment of all the schools served. And then you would do similarly for Jefferson Kids and Teen Clinic, and you can add up to 10 columns of program school-based health centers that you'll be reporting for. I'm going to go back to the questions now. So this says, can you please state the 5 performance measures you're collecting? Of course. So if you go to our website and go to the resources tab and click on quality counts and then the 5 performance measures, you can see the definitions of the 5 measures. They're the annual well child visit, risk assessment, BMI screening, depression screening and follow-up, and chlamydia screening. So the next question is, how do we pull our numbers into the portal? So what you will do is extract the data from your electronic health record that's requested and enter it by hand into our data portal. So the next question is, how extensive does the depression screening need to be? Is it 1 question, 10 questions, or a full assessment? We are not recommending or requiring, because we can, a particular tool that's used, but we might encourage you guys to use the PHQ-2 or the PHQ-9. Either of those depression screening tools are validated tools that we recommend that you're using, but it can be any of those tools. When I said I got well child, depression, chlamydia. What are the other 2? The other 2 are risk assessment and BMI screening. I'm going to quickly show you exactly where you can find those measures. If you come to this page, so that was the resources tab, quality counts, and then the 5 performance measures it'll take you to this page. You can either scroll down and click here to view the measure definition. Here you have the numerators, denominators, the source of the measure, suggested claim and encounter codes, and inclusions and exclusions. Or if you want to click here, you can download the information in a PDF. All right. I'm going to go back again to the question. I got your email yesterday but did not see a username and password info for the data portal. How do we and when do we get this information? So if you received an email from me, that means that you completed the survey, and I sent an email explicitly out to you because we already have all of the information that we need in order for you to enter the data portal. You'll receive an email again from me next week when the data portal is open with explicit directions about how to log in and enter our system. Sure. So this is the last. Oh, okay. The next question is, can you clarify what we mean by an annual risk assessment? So an annual risk assessment would be an individual risk assessment it can be either a component of a comprehensive well-child visit, or it can be given separate from the risk assessment. And that risk assessment may be something like the RAPS tool or the Bright Futures tool. And if you scroll on this page, you can see some more information about what we're describing as it relates to the risk assessment tool. It's a way of identifying potentially high-risk behaviors in youth, and we encourage you to complete a risk assessment on every student, either as a part of a risk assessment, as a part of a comprehensive well-child visit, or separate from the well-child visit every year as a way to sort of try to systematically identify high-risk behaviors. So if you review some of the promising strategies and FAQs here, you'll see what risk assessment tool should I use. Choose an age-appropriate risk assessment tool. You can see a link to the Bright Futures tool or a link to the RAPS tool here. Any other final questions for anyone today before we wrap things up? The next question is, our SBHC uses gaps. Is that permissible to report on? Yes. Yes. All right. So the next question is, can we use telemedicine to conduct the assessments? I assume that you're referring to the risk assessment. I am rather than other assessments. I'm not a telehealth and telemedicine expert. So I think it would depend specifically on the type of service being provided, but I would love to follow up with you specifically or individually, and we can talk about how. Oh, yes, you're referring to the risk assessment. I assume yes. I wonder if anyone else participating on the call is using telemedicine to conduct the risk assessment. I don't see any problem with using telemedicine as the method to collect that assessment. I don't know if anyone has had successes or challenges that they may want to quickly type into the chat box to respond to this question. All right, well, we can follow up and provide some more information on this. All right, so I want to share my contact information here in case anybody wants to reach out to me directly with any questions. That would be much appreciated, and I will be very happy to respond and be helpful. In closing, we want to encourage you to become a member of the Alliance by going to our website, www.sbhforall.org. You can find more information. And we'll end with hoping that we see you this year in California. Our National School-Based Healthcare Convention is going to be in Long Beach, California from June 18th to the 21st. So we want to invite all of you to join us there. So I really want to thank all of you for joining this webinar today, for being pioneers in this work with us. We're so appreciative of your work as well as your participation. Please reach out to us and let us know how we can be helpful. Like I mentioned, I'll be sending more information next week. So stay tuned, and we'll be in touch soon. Thank you, everyone. Bye.